Have you ever stopped to wonder about something that feels so basic during childbirth? Like, can you actually eat or drink during labor?
Right.
It's a question that pops up for, well, so many parents to be. And honestly, the advice you get can feel super conflicting.
Oh, definitely. All over the map sometimes.
Yeah, like you hear everything from absolutely nothing allowed once things get going to, oh, a light snack is totally fine. It's a real head scratcher.
The whole discussion around food and drink during labor, it's actually more nuanced and honestly pretty fascinating than most people probably realize. For decades, there was this really strict rule. No food, no drink. That was pretty much standard practice everywhere.
Right, like gospel.
Pretty much.
Yeah.
But that blanket ban, it's really started to shift as our medical understanding, our practices, they've evolved quite a bit.
Absolutely. And that's really the core conflict we want to dig into today, isn't it? That traditional no food rule versus this growing, more modern acceptance. It's actually quite striking how many doctor and midwives today are, well, totally okay with fluids, maybe even some light snacks, especially in early labor.
Yeah, definitely in the early stages.
And some are even fine with it later on, which is such a contrast to those who still say, nope, nothing, once contractions really pick up steam.
Right.
It just highlights why it's so crucial for listening to, well, talk to your own provider.
Absolutely essential. And what's really fascinating here, if you look back, is the history behind that ban.
Okay.
While it was, a valid concern once upon a time, a serious one, it's largely been mitigated, almost made obsolete, really, by how medicine has advanced.
So what was the original worry?
The big theory was all about the risk of aspiration.
Aspiration? Like choking?
Sort of. It's when food or stomach acid gets inhaled into the lungs. That could lead to really severe complications, pneumonia even.
Wow. Okay.
And the big fear was if emergency general anesthesia was needed, like for an urgent C-section. That was a very real concern back in, say, the mid-20th century.
So it wasn't just a random rule.
Precisely. Plus, even back when that risk was more of a factor, studies showed the actual rate of aspiration. It was minuscule, super rare.
So the main reason for that really strict ban isn't nearly as relevant today.
Not nearly as widespread, no. The foundation has shifted.
Wow. Okay, so the foundation for the rule changed. And here's where it gets, really interesting for me. Connecting that to the modern view. Are there actual benefits to eating or drinking now that the risk seems so low? Because it just feels like your body would need energy for such a huge effort.
Yeah, that's the logical next question, absolutely.
Oh, what does the research say?
Studies have actually shown that for many women, being allowed to eat and drink during labor, it can actually lead to a shorter labor.
Shorter? How much shorter?
On average, about 16 minutes shorter.
Whoa, 16 minutes? I mean, during labor, 16 minutes can feel like an eternity. That's significant.
It really can be. And like you said, it just makes intuitive sense when you think about what labor is.
Yeah, it's not just hard work, right? It's like the ultimate endurance event, an athletic feat.
Exactly, like running a marathon.
You wouldn't run a marathon on empty, would you? Your body needs fuel, sustained energy for that kind of demanding process. Trying to labor when you're totally depleted, that must make it incredibly hard to find the strength for those final pushes.
Absolutely. Your body's doing this incredible, powerful work. It needs the resources.
So connecting this to the bigger picture, how the body works under stress.
It just makes perfect sense. The body needs energy for something that demanding physically. And if you look at the official guidelines now...
Like from ACOG?
Yes, the American College of Obstetricians and Gynecologists, ACOG. They're a leading authority. Their guidelines generally approve clear liquids for uncomplicated labors.
Okay, so clear liquids are generally a green light. So what if you've heard all this, you understand the benefits, but your practitioner still says, nope, nothing by mouth?
Yeah, that's a really common scenario.
How do you handle that?
Well, our advice is definitely to talk about it with them. Have an open conversation. You could even gently mention the ACOG guidelines, maybe ask about their specific reasoning.
Right, understand why they're saying no for your specific case.
Exactly. Have that informed dialogue. But at the end of the day, if they still advise against it, it's generally best to follow their specific medical advice. Their main concern is always keeping you and the baby safe and healthy. There might be a very specific reason related to your pregnancy, maybe a potential complication, that's guiding their recommendation.
Okay, that's fair. Trust your provider's judgment for your individual situation.
Right.
All right, so let's shift gears. Let's say you do get the green light. what then? What should you actually reach for? Because clearly it's not time for a 5-course meal.
Definitely not. The key words here are think small and think light.
Okay.
You want snacks that are easy to digest, give you some sustained energy, and of course, lots of liquids for hydration.
Makes sense. So what kind of solids fit that bill?
Okay, specific foods.
Yeah.
It's all about easy energy without making your digestive system work too hard. First up, toast with jam.
Classic comfort food.
Totally. It's bland, but it's sustaining. Gives you a nice quick energy kick. Whole grain toast is even better if you can get it. Lasts a bit longer.
Okay.
But here's a crucial tip. Skip the butter. And skip the peanut butter, too.
Really? Why?
Yeah, they're just harder to digest. They can sit heavy, and you don't want that.
Gotcha. Easy energy, minimal digestive work. What else?
For things that go down super easy, think applesauce or Jell-O.
Ah, yeah, those are easy.
Quick sugar boost, which you'll definitely appreciate as things ramp up. And then for something refreshing, especially when you're feeling hot or working hard, popsicles or sorbet.
Ooh, I could see that being amazing.
Right. They hydrate, give you that energy jolt from the sugar, and if they're fruit-based, maybe even a few vitamins. Way better choice than ice cream, though.
Why better than ice cream?
Same reason as the butter. Avoid the fat and dairy. Keep it light.
Okay, so the pattern is light, simple carbs, easily digestible sugars. Got it. Now, what about liquids? Water, obviously, is key.
Absolutely. Water is non-negotiable. Sip constantly. Your support team should be reminding you.
But what else might be allowed or even recommended?
Clear broth is a fantastic option.
Like chicken broth.
Chicken or vegetable, yeah. It's warm, easy on the stomach, and actually pretty nutritious. Comforting, too. Helps with electrolytes.
Okay. Any tips for broth?
Just watch the sodium. Homemade or low sodium is better than the super salty canned stuff, which can actually make you thirstier.
Good point. What about other drinks? Juice? Soda?
Yeah, many places are fine with fruit juice, as long as it doesn't have pulp. Gives you quick sugar. Some carbonated drinks like seltzer or maybe even Sprite can sometimes help settle an upset stomach or just be a nice change.
Okay. Tea. Coffee?
Regular tea, maybe even black coffee might be allowed, usually in moderation, especially if you're used to caffeine.
Yeah.
And sports drinks are often suggested too.
For electrolytes.
Exactly. Helps replenish what you lose through sweat, especially if labor goes long.
And then there's the classic, the delivery room staple, ice chips.
Ah, yes, the humble ice chip. Can't forget those.
Are they pretty much always allowed?
Almost universally, yes.
Yeah.
Even if you're under strict nothing-by-mouth orders, ice chips usually get a pass.
And they must feel amazing.
Oh, totally. When you're doing all that breathing or the hospital air is dry, your mouth gets so parched, a few ice chips are just incredibly refreshing. Hydration without the volume.
Okay, that makes total sense. Now, flipping it around, why is it important to avoid certain things, even if you feel ravenous, which, let's be honest, might not happen once contractions really kick in?
Right. Eating might be the last thing on your mind then.
But maybe on the way to the hospital or in early labor? What's definitely off limits?
You really want to resist anything too heavy. High-fat foods, anything super fiber-stuffed. Definitely avoid those.
So grabbing that celebratory burger and fries on the drive over?
Probably not the best idea. Definite no-go.
Okay, let's pivot slightly to someone else who's really important in that room. The support system. Your partner, your doula, family, friends. What does all this eating and drinking advice mean for them?
Yes. Such a crucial, often forgotten piece.
Right.
We focus so much on the person giving birth, which is right, but the support team, they have a huge job too, often a long and tiring one.
Totally.
So while the laboring person might not feel hungry or might be restricted, their support system absolutely can eat. And frankly, they should.
Why is it so important for them?
It's practical. It's about preventing your partner or whoever is there for you from getting lightheaded or even fainting from hunger or exhaustion right when you need their support the most.
Oh, man, I can imagine. They need to stay strong, too.
They do. They're providing continuous physical support, emotional encouragement. They just can't do that effectively if their own energy crashes. Their blood sugar drops, they get foggy. Not helpful.
No, definitely not. So what's the specific advice for the support crew?
Okay, concrete tips for anyone in that support role. Number 1, have a good, solid meal before you leave for the hospital or birth center.
Don't wait until you're starving.
Exactly. Fuel up beforehand. And maybe even more important, pack snacks. Lots of snacks.
Good call. What kind?
A variety of easy-to-eat things. Protein bars, trail mix, fruit, maybe some sandwiches, even those clear broths we talked about. Drinks, too.
So they don't have to leave your side to hunt for food.
Precisely. The goal is they can grab something quickly without having to leave you alone when their stomach starts growling. It's about making sure everyone involved is supported physically and mentally for this huge event.
Yeah, they're your rock, and even rocks need fuel.
Well said.
Okay, so let's try and wrap this up. Always talk to your doctor or midwife about your specific plan. Their advice is paramount.
It really is. And, this whole deep dive into fueling labor, it really highlights something broader, I think.
What's that?
Just how our understanding of the human body, its incredible capabilities, it just keeps evolving.
Yeah.
Even for something as fundamental, as ancient as childbirth.
Yeah, it shows medicine learning and adapting.
Right.